Welcome back, everybody. According to Statistics Canada, oral contraceptives are one of the most frequently used medications by Canadian women. But there are now newer forms of contraception on the market, and they are gaining in popularity.
That's why we've called in our medical expert, Dr. Sheila Wijayasinghe, to break down everything you need to know about birth control. Dr. Sheila, welcome back.
Thank you for having me. Nice to see you both.
Nice to see you, too. Let's start by addressing the blood clotting risks with birth control. It's a concern that women raised again after rare blood clots associated with the AstraZeneca and Johnson & Johnson vaccines were reported. So let's talk about what blood clots are linked to the pill versus certain vaccines.
And that's a great question. I think the discussion came up quite a bit for my patients and I, and across the country, we noticed this when we were discussing the clots related to the vaccine, specifically AstraZeneca as a concern. And those clots, it's important to know that that comparison was made to create a bit of context for people to understand that the clot risk with vaccines is quite low compared to something that we use every day, like the birth control pill. And what I really want to do is to clarify is that there needs to be some context to that. So with the vaccine-related clots, there's a different mechanism of action. We know it's related to a decrease in platelets. In terms of the birth control pill, it's related to estrogen content. The mechanism of action is very different. The severity is different as well. We know how to treat birth control-related clots very well, whereas we're just learning more and more about the vaccine-related clots. So there are different things, different mechanisms, different severities as well, and locations. But it's important to put that into context so that we don't. It's helpful to help us understand things, but it's not the same thing. So it's like comparing not apples to oranges, but apples to almonds, if I may say, that they're different types of clots, and it's important to understand that difference as well. What it's done is help me with my patients to bring up the issue around clotting and to see that this is a discussion that we need to have when we're prescribing the pill.
So speaking of the pill, 3/4 of women take the pill at some point in their life. So the question we have next is there any woman that you would advise not to take the pill?
So for the majority of people who take the pill, it's a very safe option. And so many of us have been on it at some point in our lives, and we've been able to do that safely. But like any other medication that I prescribe, it's important to go over risk factors. So certainly with the pill, specifically the estrogen-containing options, so not just the pill, but the patch and the ring as well, there are risks associated with it. Specifically, we just mentioned clotting. So that is one thing that I go through first. So do you have a personal family history or a personal history of clotting? Do you have any other risk factors that might increase the risk of clotting, like smoking, especially smoking over 35, if that's the case, I may try to discuss a low-dose pill option or a progesterone-only option to reduce your risk. The other option as well that we look at is around, is there a risk of high blood pressure? Estrogen can increase your blood pressure. So if you have blood pressure that's not under good control, it's important to get that under control first before being on this form, or find an option that's safer to use as well. The other thing to consider is that there are people who have, migraine with aura. That is something that is a type of migraine that comes with neurologic changes before the migraine comes on. And if that's the case, that's actually associated with an increased risk of stroke for people who take estrogen. And so we want to avoid using that type of pill type or type of contraception with people who have migraine with aura. So those are the main things I look at. And then we decide what's safest for you in terms of contraceptive options. So there's so many options that are available if you do have those risk factors.
I mean, obviously, when it comes to the birth control pill, you need to take it daily in order for it to be effective. So if some people are worried about, misuse or not using it exactly that way, what are some other options that work like the pill but aren't a daily medication?
That's a great question. So, the pill's only as effective as if you're taking it at the same time daily. And so for some people, especially those who may have small children around, do shift work, teenagers with different schedules, it's really hard to take something at the same time. And for that reason, there are options like the patch, which is a sticker-like option that has estrogen and progesterone that you wear once a week. You change that once a week. So that's a nicer option. You set your schedule for once a week, or you have apps that can help you remind you. There's also the ring that is a flexible plastic ring that goes into the vagina, so you have to be comfortable inserting it, but that goes in once a month. And so that you set your calendar and you know that you're changing that once a month. The other option is the Depo-Provera shot, which is a progesterone-based shot that you get every 3 months. So those are great options that are easy to remember because they're less frequent in terms of a daily option, and very effective because they rely less upon us taking something daily.
Yeah, another one that a lot of people talk about, and really its use has been skyrocketing, is the IUD. So first, tell us about that and other sort of longer term options.
I love the IUD and long-term options because, again, who has time to think about contraception every day, or even for some people monthly or weekly is sometimes difficult to remember. And so the IUD and the implant are two options that are really great. They're long-term options. So the implant specifically is 3 years. It goes under the skin. Both of these options do have to be inserted by a healthcare professional. Once they're inserted, though, you don't have to think about it. So the implant goes in for 3 years, and then you can remove it at any time. It doesn't have to be full 3 years. You can change it before that. The IUD, there's a copper IUD, which does not have any hormones in it. So if you're someone who can't take hormones for whatever reason, or you don't want to, you can have that option. That gets inserted. That can go in for 5 to 10 years for some of the options. And the other is the IUD that has progesterone in it, which is an excellent option. It thins the lining of the endometrial lining too. So you have thinner linings, you have less period flow. It's very easy to do. And then it's 5 to 7 years for that one. And so those are effective. They're 99% effective because they, again, don't rely upon us having to take something every day or every month or week. And so that's really very helpful. And they also have protective benefits. So the Mirena, or the IUD that has progesterone, does decrease the risk of endometrial cancer because of the thinning of the lining as well.
Do any of these birth control methods impact future fertility?
That's a great question. So no. So these are reversible methods of birth control. So if you're ready to start trying for pregnancy, or you would like to try for fertility, these basically you either remove them for the implant or the IUD, or you stop taking the pill, patch, or ring. Sometimes there can be a slight delay in return to ovulation for some of these options, but they do return over time. But that doesn't affect future fertility.
A common complaint about hormonal birth control is the effect on mood. So what should people know about mood or emotions and hormonal birth control?
So it's interesting. So for some people, definitely, if you have a history of depression or you have a sensitivity to hormones and the fluctuation in our cycle, so especially prior to your period coming on, there's a drop in estrogen and progesterone and you get your period. And that can be a very vulnerable time for people to actually have mood changes that can then cause quite significant distress. And so for those individuals, sometimes being on the pill can actually be harder because you have this fluctuation, but for some it actually can be helpful because we're creating a steady dose of hormone that happens throughout the month. And you can also consider skipping a period with the pill or with the patch or the ring that allows you to have a steadier state of hormones, and then you won't have that flux. But for some people there is a change in their mood, and that for that reason I always suggest talk to your doctor, let them know that this is happening. You'll know within the month if that's causing a change, and we can look at other options like lower dose options, changing the formulation up. There's so many options available that it's actually very helpful for us to know so that we can help you, and don't sit in silence because we can also help you through that.
So, lastly, how do you advise patients on how to choose what is the right method for them?
So choosing your birth control options can take a little bit of a conversation because there are so many different options available. So you want to know what's the easiest for you to find. Is it weekly? Is it monthly? Is it daily? Is it something like a long-term option? Is that what's best? How effective is it? Does that matter to you as well? Because some people want the 99% versus the 90%, right? And so that's also important. It's important to know about ease of access. So depending on where you live in Canada, there can be different options available to you in terms of, can you get an IUD inserted here, or is it easier just to get the pill because that's easier to prescribe and it doesn't depend upon having a healthcare provider insert it. So that's something else. And the one thing that I always talk about with my patients is that, is this something that you need to keep private? For some people, having a pill or having something that is visible to other people might not be safe. And so if that's the case, we can look at options that are more invisible that can be helpful to help you through and give you good birth control while keeping you safe. And cost is also the final option that I always discuss. There's cost differences between the different forms of birth control, and there are clinics in each city that offer at lower cost. RAICE.ca, RAICE.ca is a great website that actually helps to guide you to find a provider that does IUD insertions or sexual health clinics in your neighborhood that can also offer low-cost birth control options as well. So all of those factors come into play. There's lots of different options available, but it does involve a discussion and finding out what the right fit is. And if it's not the right fit when you try one, we have others that are available.
Dr. Sheila, always a pleasure. Thanks again for joining us today.
Thanks for having me.
We'll be right back. Don't go anywhere.